Good evening. A heated debate over vaccine mandates is taking over the Statehouse, and the new legislative session hasn't even started. Here's the question. Should your employer be able to make you get a COVID shot? For tonight's big story, we dig into the latest proposal that essentially says no. And we're hearing the argument from hospitals, once again overwhelmed with COVID cases and a whole lot of other sick patients too. But first, businesses weigh in on how banning vaccine mandates would impact them.
The groups that spoke out Thursday afternoon here at the Statehouse against passing the bill say it will only prolong the pandemic. The Indiana State Medical Association, the largest physicians group in the state, warned against passing it. So did the Indy Chamber, representing 2,000 businesses in central Indiana.
Until now, Indiana lawmakers have been silent on employers requiring vaccines, except when it comes to Hoosiers working for local governments. The General Assembly passed a law last year prohibiting local governments from requiring proof of vaccination for employees. This latest proposed bill would eliminate most employers, including hospitals, from requiring employees to be vaccinated. Businesses would have to allow medical or religious exemptions for employees, or allow a testing option, and businesses have to pick up the tab for the test.
What the bill says specifically is that it would be at no cost to employees. If you do any kind of interpretation there, right, it's like the employer has a testing requirement and you can't charge the employee, so who's going to pick up the bill? It's the employer, right?
Taylor Hughes with the Indy Chamber says that would be an extra burden on businesses trying to rebuild after the pandemic. Hughes testified against the bill Thursday, saying employers need flexibility on the issue of requiring vaccines if Hoosiers want to see businesses bounce back.
It really is about getting out of this pandemic as quickly as possible so that we can rebuild, right? It's like if we hamper our ability to respond to a pandemic that's still continuing, we can expect to be battling it for much longer periods of time, maybe for years to come.
Session resumes in January, and with the new year comes the first reading of the bill on January 4th.
As Emily just mentioned, the Indiana State Medical Association joined the opposition against the new proposal today. Several doctors also took to the floor and said they're overwhelmed and they need more people to get vaccinated.
We are tired. We have been able to scale up ICU beds and ventilators, but we have not been able to scale up people. There are no more of me. There are no more nurses.
Those speaking against the mandate ban were in the minority at the State House today, and more than half of the House of Representatives are listed as co-authors on the bill. But the bill's sponsor says he's open to making changes to the proposal.
When it comes to the spread of COVID across our state, we reported more than 5,000 new cases today, along with more than 3,000 COVID patients in the hospital this week, and a 7-day positivity rate of 14%, more than double the state's goal. So far, Indiana is not among the states reporting cases of the Omicron variant, but almost every surrounding state has at least one case. And with the fast-spreading nature of this variant, doctors say it's really just a matter of time. Right now, the CDC predicts the country as a whole could see more than 1 million new COVID infections by Christmas, and that could be bad news for Indiana. Indiana ranked 51st in the nation after WalletHub examined vaccinations, testing, hospitalizations, deaths, and transmission. The company's been updating its study every couple of weeks for more than a year now. We originally ranked in the middle of the pack, but have really fallen while other states improved. You can read more on the WalletHub study and the fight over vaccine mandates right now at WTHR.com. And that wraps up tonight's big story.